For patients, the time from diagnosis to treatment start is very important. So for us, anytime we're able to condense one or more of the steps, that's quicker, that the patient's able to get the treatment they need. We need as many tools that will help us to do that as possible. AI is one of those tools. Cancer is not becoming less common, it's becoming more common. To explain what we do in radiation oncology, I will get a CT scan, which is where I begin my treatment planning. Then I'm using that imaging in a computer to outline, this is where the target is. I have to figure out, how do I cover the target without hitting the other organs nearby.
One of the big points of using Siemens AI is the standardization of the radiation treatments, whether that be for prostate, breast, particularly in head and neck cancers where the delineation of contours in head and neck is extremely difficult.
The partnership that Geisinger has with the Siemens Healthineers and Intel, it allows us to offer really cutting-edge technology to our patients.
Siemens Healthineers is a global med tech company that's focused on bringing innovation to both healthcare professionals and patients. One of the groundbreaking pieces of software that we've delivered as part of this partnership is what we call the AI Rad Companion. And the AI Rad Companion is a set of AI algorithms that are there to help the clinician in terms of speeding up both diagnosis and therapy. The Intel Xeon scalable processor is what powers the AI Rad Companion.
AI Rad Companion has definitely been a benefit to our workflow. Let's say I'm treating a woman with breast cancer, and I have to treat the breast and the lymph nodes nearby, and I want to preferentially avoid her lungs and her heart. I will use AI to very quickly outline all of those structures.
Producing these contours generally takes quite some time. Creating the contours in a reduced time frame allows our dosimetrist staff to create a plan and start the treatments in a shorter time frame.
I just see it helping us get closer to making diagnoses earlier on the radiology side, helping us get patients treated faster and identifying which treatments need to be done, and helping patients get back to their lives.
You can already see the huge impact that technology has, not only on the healthcare delivery, but also on the patients themselves. And we're excited to see what's going to happen next.